Welcome to Healthcare IT Today. I'm John Lynn, together with my colleague and friend, Colin Hung. The world of technology and healthcare are ever-changing in new and novel ways. That's why we love this stuff so much. So join us as we discuss the latest healthcare and health IT news, meshed together in new ways which help generate ideas and new perspectives. Plus, we'll have a little fun along the way. On today's episode, we'll be discussing why healthcare IT. And today's episode is sponsored by Galen Healthcare. You can learn more about them at galenhealthcare.com. Be sure to follow the show on Twitter at the hashtag HITSM and our personal accounts at TechGuy and at Colin_Hung. Plus, check out our 13 years of health IT blog content at healthcareittoday.com. Wow, Colin, we've started it, our first episode.
I know, it's incredible. It took us this long to finally do one, but yeah, looking forward to it. This is going to be exciting.
Yeah, well, we've done so many video interviews and video discussions and Twitter chats and blog posts that it's pretty exciting to do a radio show. Obviously we'll push it out as podcasts as well. It's exciting to, have that kind of live feel of radio.
Yeah, although we have to improve our own little voices, because I'm going to bet when I listen to this, after we record it, I'm going to be like, man, I sound like an idiot. But no, this is going to be fun. I'm looking forward to talking about a lot of the news and a lot of things happening, and it's going to be fun to have this sort of back and forth in this sort of live environment rather than just you and I on the phone.
Well, I guess that's kind of what we're shooting for is, that the discussions that we would have in the hallways at a conference or, kind of the engagements we might have as, if we're at a networking event, so hopefully that's the feel that we create and, bring a little bit of that to our show. So, I think that's the exciting part. And I don't know how you're going to listen to it. I can't listen to myself. So I'll leave that to someone else.
Oh, that's fun. Actually, that's a pretty good segue. We put this little slide together for those of you that are watching this, just to kind of give you an idea of what you can expect from this radio program. And really, the idea behind it, John, you and I talked about, keeping it fun, keeping it like the conversations you and I have at conferences and on the phone together, and really just trying to take a lot of the stories that are happening, and there's so much happening every day, and kind of mesh it all together, make some sense of it, and then out should pop some new perspectives, some new ideas, hopefully some practical advice as well, but all done in this sort of conversational style. We don't want to be sort of preachy or be too much like some of the other content that we provide. So this one's going to be a little bit more dynamic.
Yeah, well, and I think that's one of the interesting things that we have as bloggers, and as people that work in the space. We get to attend so many conferences, so many events, and hear so many perspectives that, hopefully we can bring some of those perspectives that we see and hear from, I think I average about 20 to 30 conferences a year, and I know you've done even more than that in the past. And, so, I think we provide, hopefully we can share some of those insights in this kind of conversational approach. So I think people will enjoy it, hopefully.
I hope so too. And yeah, you can see just on the little corner there, I've kept some of my badges up against the wall there. So go to a lot of conferences. And yeah, these are the kind of conversations that we have there. And hopefully we're going to bring that to this radio program. So I'm excited about that and excited to dive right into these first topics.
Great. Let's get started then.
All right. So on today's discussion in episode 1, we're going to be talking about 4 topics. Here they are. Number 1, we're going to talk about why healthcare IT. Why did I, kind of get into this healthcare IT gig, what it's all about. We're going to talk a little bit about what is innovation, kind of define it or how we define it. Then we're going to talk about who's really responsible for innovation in healthcare. Is there actually a single individual or a single department that's responsible for it? And then we'll cap it all off by talking about where is innovation happening now? What are we seeing based on some of the conferences that we've been going to? So those are the 4 topics, and we're going to dive straight in. So John, let me ask you, why healthcare IT? Why did you get started? How did you get started? Tell us that story.
Yeah, there's so much to the story, but really, everyone knows that I'm a tech guy by background. That's why I'm literally at Tech Guy on Twitter. I come from that server administration, data center world, and I ended up getting a job at a university health and counseling center. And I just remember when I got the job, I would go up to people and I was like, how amazing to think that if I do my job right in healthcare and with technology and using technology to improve healthcare, if I do it right, I could influence a patient's life, right? I mean, possibly even save their life, which I know is a pretty ambitious goal, but that's what I really attracted me to the job in the first place was, wow, instead of helping college students be successful, because I worked in a university setting initially, instead of doing that, I'm actually helping patients and impacting their lives in a way if I do things the right way. So, for me, that was where it all started, was that kind of passion to, hopefully improve the healthcare system. I know one of the my favorite things about you, Colin, that when we first met and we started talking, you described yourself as a healthcare IT believer, and at first I was like, a health IT believer, like I don't know about that, right? Like that, it almost felt like too hoaxy or like almost like a religious cult following, like I believe,
That's right. I
And so,
believe I do.
yeah. But at first I was like, oh, I don't know if I like that term. But the more I've talked to you, it's like, yeah, I mean, I really am a health IT believer, but not in the cult following kind of way, but more around the idea of, yeah, I believe that technology can and should improve healthcare. And certainly it hasn't, lived up to its billing. And I'm sure we'll talk about this, over all these episodes in the future. But I believe that technology can and will improve healthcare. So, that's the place that I come from.
Nice, nice. I'm going to share a story that I don't think I've shared too often with many people, but I actually, like you, started my career in as a developer, if you can believe it. So I graduated with an engineering degree, but then, kind of didn't want to do engineering after a little short stint at a car manufacturer. And then I went and got a job as an IT person at this consulting company. I was actually doing coding. And then one
Wow.
day, my manager, yeah, I know, me coding, can you go figure? But
I just figured out a new talent we can use at healthcare IT today.
yeah, that's not happening. Let me tell you, and they'll tell you why. So about 6 months into my new job, I loved it. I was enjoying it. But as an engineer, you're taught to like over-engineer stuff, right? Factors of safety and all that kind of stuff. So my manager at the time, who was also an engineer, called me into the offices and said, "Colin, I got to sit you down. You need to make a decision." And I'm like, "Oh, okay. What do I need to decide?" And he goes, "You either should go into consulting, like full-time, just project management and be a consultant because you're really good at that. You like to talk." Or you got to really dedicate yourself to being a better developer because you're too slow. You take too long to code stuff. And I was like, oh. And I was like, so this is like you giving me a hint. I really shouldn't be a developer. And he goes, yeah, you really should be on the consulting side. So I moved over to the consulting side from after my short stint as a developer. And I did a lot of work actually early on with payers. So a lot of insurance companies and do a lot of claims processing. And this is back in the day when document management was sort of very new. And I loved it. I loved that workflow. I loved kind of figuring stuff out with technology. And then from there, I just got more and more specialized until I really just became a specialist in healthcare and have been in healthcare ever since. And like you, I love healthcare IT because it's not just about the technology. It's about helping either the clinicians or the administration or patients. And so it's not always about the bottom line like it is in many of the other industries. And that's why I love being in health IT. Plus, I love the technology. I mean, it's just fantastic. And the people in healthcare IT everyone I've met have been amazing. And so that was what excites me about this industry, and that's what excites me about being sort of in this space.
No, it's a good point, right? I mean, certainly there's plenty of, scammers and are, like any business, but for the most part, you know, even if they don't execute it properly and maybe they don't achieve the goals and the visions they want to accomplish, the people really do have the right goals and intentions for the most part, from what I've seen, and that's what makes it exciting to be part of this industry.
Absolutely, absolutely. So, John, let's talk about the next topic here. It's a touchy one. I know you and I have talked about it many times, but what in your mind is really innovation?
It's a challenging topic, right? And everyone comes up with their own definitions. And for me, I don't care so much about the semantics of it, but what I care about is actually impacting care, right? Like, how do I actually impact the patient? And in some ways, that means impacting the doctor. or making the doctor's life easier, making the nurse life easier, making the HIM director, making their life better so that they can deliver a better release of information to the patient so the patient can get access to the right information. So for me, if I were looking at a broad definition of innovation, I'm thinking what's anything that can be done to make those users' lives better so that they can improve the patient experience. And, to me, it's all tied together. This idea, you just need to focus on the patient or you just need to focus on the provider. It's like, no, it's all intertwined. But my problem is, with most people that talk about innovation, is that they only want to talk about what I call breakthrough or disruptive innovation, the thing that's going to transform the healthcare industry in a way that's never been seen before. And it's like, that's great. And I'm glad people are thinking about that. But, that's not the innovation that excites most people. It's great that AI one day is going to replace the doctor, which, maybe that's a discussion for another day. But, okay, that's great. But if I'm a CIO or if I'm a CMIO or a CMO at a hospital health system, or even if I'm a doctor in an ambulatory practice, that doesn't help me, right? So the innovations that excite me is, as part of Expo.Health, our conference on healthcare innovation, we really focus on what are practical innovations. And there's this whole series of other innovations that go beyond the disruptive and the breakthrough innovations. Something simple as a business process innovation or incremental innovation. That's actually what excites me most.
Very good. And by the way, I really applaud you throwing in the Expo.Health plug in there. I applaud you. The marketer inside me is applauding you for that. So good on.
Yeah,
Good for
well,
you.
it's just that to me, that's where we, you and I, worked on this a lot, right? And that's where we developed this idea of the different innovation models, right?
Well,
And
yeah.
how do you create innovation in a healthcare organization that they actually care about?
Well, yeah, and that's sort of my thing as well. To me, there are many forms of innovation, and the one thing I will say is that I think innovation does have to be new. I think there's a differentiation between something that's incrementally improved versus something that's new. But I think the definition of new does not mean new to the world, and that to me is a big missed opportunity for not only healthcare but many industries, where you could take something that's worked in another organization, non-healthcare, bring it to healthcare, and to me that's innovation. So if you took something from the consumer world, if you take something from airlines, if you take something from manufacturing and apply it to healthcare and twist it so that it fits into the world of healthcare's workflows and politics and payment models and those kinds of things, to me that's equally an innovative approach. It doesn't have to be net new. And I think that's where really a lot of people have made the mistake of going, well, it's not innovative if it never existed before. It has to be something brand new and unique. And I think that is got too many people focused on that shiny object. And I think instead, if we focused on the other forms of innovation where, hey, why don't we just take some time and motion studies that have been done ad nauseum in manufacturing and go, hey, why is this printer located on the other side of the nursing unit? It should be right here. That's where people, to me, that's innovation. And it's not, did I invent something new? No, but I applied a process that maybe I've learned in another industry to healthcare. And so, like you said, I think there's many forms of innovation, and I think we're just a little bit too fixated on the breakthrough innovations. And so to me, innovation still has to be new. It does have to improve on the existing, but it doesn't have to be brand new to the world.
Yeah, I would also, I love that description, and bringing the innovation from other industries into healthcare is a powerful idea. But I think the other way I look at it, especially in healthcare where it's so disconnected, where a hospital in Boston doesn't really talk to a hospital in Stanford, in California, and there's no real competition either, right? That's changing some with telemedicine, but for the most part, they don't really see themselves as competitors. And if they do something in Boston that's innovative, but the people in California and Nevada and Texas don't know about it, to me, that's part of that innovation framework that, really is frustrating to me. And that's actually one of the goals and missions for me is how do we take innovations that are happening maybe in in 5% of the healthcare organizations and spread that innovation and make the other 95% of organizations aware of that innovative approach to a problem. So I guess that's the other part of innovation for me. It's like, oh yeah, it's already been invented, but maybe no one else has heard about it.
Right, sort of that positive deviance kind of approach. Hey, it's working over here. Why not bring it somewhere else? So actually, that's really good. So if you're just tuning in, you're listening to Healthcare IT Today Radio with John Lynn and Colin Hung. That's me. And we'd like to take a second to thank our sponsor, which is Galen Healthcare.
Yeah, so Galen Healthcare, we've known them for a lot of years. I mean, I go so far back, even before Twitter came around, we were engaging with each other on blog posts. I would call it blog sparring at the time. I mean, this was before Twitter, so we didn't have a way to engage. So we engaged in the comments, or we replied to each other with blog posts. So we would share insights with each other into things like managing legacy applications and EHR conversions, things that I quickly realized Galen Healthcare knew a lot more about it than I did. And, no doubt this experience, that they had came from all their years offering health IT consulting services and really, helping their clients to achieve more efficiencies with health IT and with EHR. And more recently, it was exciting. We worked with Galen Healthcare as they won our first ever Expo.Health Practical Innovation Award for their product called Ingenuity, which their Ingenuity product optimizes a Meditech rules engine. So anyone that uses Meditech knows all about the rules engine and the need to optimize that. And Galen created a product line around that, which is a powerful way for Meditech EHR users to improve. But certainly that was a well-deserved honor that they received. But as I think about Galen, if you're looking to optimize your EMR implementation or EHR implementation, depending on how you like to describe it, or even if you're dealing with legacy applications, be sure to check them out at galenhealthcare.com, see what they can do for you. They offer, just a depth of experience. There's so many years optimizing EHRs and also, working on legacy applications, EHR conversions. So check them out at galenhealthcare.com. Thanks, Galen.
Yeah, thanks, Galen. Good group. So let's continue our discussion. So we were just talking about innovation before the break, and now we're going to talk about, so who is responsible for innovation? Is there anyone responsible for innovation in healthcare?
Yeah, and the cop-out answer is everyone, right? The problem is if you say everyone, then no
one does it. Yeah, exactly.
Responsible for innovation. And I mean, at the end of the day, I've seen in every organization that I've looked at, it's all about the leaders. Occasionally you have someone underneath that, is just a go-getter and they'll do some innovative things. But for me, it's the leader and the leader creating a culture for innovation. And it's sad, right? I mean, we see this when we talk to a lot of the CIOs and, see it on Twitter a lot with CIOs that really are forward thinking. The question is, are you going to be a command and conquer type of leader that forces your organization to do what your bidding is? Or are you going to create a culture as a leader that encourages people to bring up innovative ideas, to push the envelope, to maybe try things that could fail? And have you created a culture that allows for failure? And the sad part in healthcare is that a lot of organizations haven't built that culture.
Yeah, no, I agree. So definitely, I think the wrong answer is everybody. I also think
that a lot of people give, though.
I know, and I think a better way to put it is I think everybody should feel the ability to bring ideas forward, but I think innovation does have to start with leadership. And I would not say that has to be the CIO or the CEO, but it has to be someone with the authority to actually do something about it, because otherwise it's just an idea. And like, yes, all of us can have ideas, but you have to be in a position where you can actually, bring about the change, the modifications to the workflow, the technologies and so forth. So for that reason, I look at sort of the director levels and above as sort of my targets of, okay, look, if you're a department head, you should be responsible for maybe not doing the innovation yourself or having to come up with the idea, but creating the environment such that the docs that work for you or that the nurses that are in your under your care, they're able to bring forward some of these thoughts, and then you are the bridge to, let's say, the IT department or the bridge to the finance department, depending on what the innovation is and who you need to bring in to make it happen. So to me, I agree with you. I think it's a cultural thing, and I think that it's really up to hospital leadership and physician practice leadership to be the ones responsible for going, okay, we're going to make it a point to really think about things in a new way and try to be innovative.
Yeah, no, I think it's a great point. If you don't have, the directors involved, the CIO has a challenge implementing it, right? So, you need both involved if you want to achieve it. And, but that's what great leaders do, is they bring their people on board, they listen to them and hear what needs to be done, and then they incorporate that into it. So, at the end of the day, is anything in healthcare not driven by a committee?
It's true. It's true. Although you would hope that innovation doesn't need our committee, like, buy-in. But I think unfortunately a lot of healthcare is interwoven, so that, if you try to change one area, you're bound to impact another. So you have to get the buy-in from all those other stakeholders. But I think that's the other thing too, is, that culture of innovation is also a culture of courage, right? Like to bring up the idea and kind of have it, be willing to have it shot down, right? Like not every idea is going to be implementable or be a good one.
Sure.
But the point is not to stop bringing them forward, right? Like that's the resilience that you need.
Right, and you have limited resources, so.
Absolutely. Okay, so final question. Where is innovation happening now? From all the shows we go to, from all the people we talk to, where are some of the spots or technologies that are really getting you excited right now, John?
Yeah, when I think about this, I'll never forget Will Wider. He's at Candid CIO on Twitter. One of the most innovative CIOs that I know, early blogger as well. I asked him one time, I said, what's the exciting thing that, the challenging thing you're facing that no one is talking about? And I asked him this question during the middle of the meaningful use, golden age of EHR era, right? Where everything was meaningful use. And he said, the thing that worries me is my 1,000 Windows XP desktops. He's like, I need some innovation to help me solve that. So in a lot of ways, I'm interested in those innovations as much as anything, because that allows a CIO the time and the energy to think about other disruptive innovations, right? So, I mean, just some examples, I love what Soaring Eagle is doing to optimize the databases so that your Epic implementation or your Cerner implementation or whatever EHR you're using will load in 0.5 seconds rather than 3 seconds, or as one person said, 12 seconds, which I was like, are you kidding me?
Right.
Like that's an innovation that, people underestimate. Even today on one of our blogs, we had Burwood Group write about the contact center and the need for a contact center. And as we think about, patients becoming more finicky about who they work with and who they choose to, go to, the contact center really matters. And that includes things like call center, which is like, wait, are we talking IT or are we talking call center? But the best solutions I've seen, the biggest innovations, incorporate some human and some technology. So there's a couple of them. What's the most exciting thing you're hearing?
Kind of a mixed bag, so I'll name off a few. So, I've been recently doing, a lot of traveling and looking at various technologies. So one of the things that's got me excited was actually kind of this merging of technologies that are applied in other spaces, like in this case, mining. So like using geographic data to map healthcare issues. So, ESRI is doing some pretty interesting things around social determinants of health. And using that, of course, they've got already a mapping application that helps with the opioid crisis, but they've got a new one that's actually mapping things like income levels and access to healthy food at certain price points. And they're able to map that in a visual way and provide that to public health authorities. And now who are able to kind of look at their programs that they've got available and make a new call or make a different call, or realize that the program they have created actually is causing these sort of gaps in the community. So to me, that's pretty exciting. And you wouldn't think of it as healthcare. I mean, SDOH is definitely sort of new thinking. But I like that. That to me is a very innovative approach to a very old problem, and then using new technologies from other industries applied to it. So that's what got me excited. I'm also excited about some of the work that people are doing in AI, but not sort of the fancy AI that we hear about in the
Or chatbot, or
yeah.
what type of AI?
No, I'm thinking about AI that's actually helping with workflow. So the example here is kind of what Nuance is doing and a few other companies are doing, where they're using AI to help people prioritize work that they should be looking at. So it's not really like making a diagnosis or anything. It's not even trying to, help a doc say, okay, this person's got these 5 conditions. It's more around, hey, like there's something here that's a bit odd, it's a bit out of the norm. You might want to look at this one. And I'll float that to the top of your queue. These ones look kind of normal. I'm going to put these at the bottom of the queue. And so it's just a very simple sort of prioritization that they're doing with their AI. But in my mind, that's going back to something you said, where it makes a big difference in the work-life balance and the workload balance for that particular physician.
Yeah,
So,
I heard some of that at the recent Meditech MD and CIO forum, where they said, okay, well, let's use the AI to understand what information to present to the doctor, because there's so much volume of information in the EHR that it's just too much. So I like that. I also like it for the idea, when are we going to replace the doctor, where literally the voice captures it, the NLP processes it, and it just documents for it? There's a bunch of companies working on that, but it's a hard problem to solve.
yeah, voice technology is definitely very cool. And I think on that note, John, we were kind of out of time on our first episode. So hey, we made it all the way through and we didn't muff it up too bad. So, hey, listen, thank you to all of you who've tuned in to our inaugural episode of Healthcare IT Today. We really enjoyed having you. Hopefully you've enjoyed the episode. You can find out more details about the show on the programs page of healthcarenowradio.com, which is where you're listening to this. And share your voice and engage with the community at healthcareittoday.com or on Twitter with the hashtag HITSM. I'm Colin Hung. This has been my friend John Lynn. And until next time, have a great week.